This video is a revision aid on the 6 rights of medication. The 6 rights of medication are the right person, the right medication, the right dose, the right time, the right route, and the right documentation. The right person. How do you identify the right person? The easiest way to do this is to ask the person to tell you their name and date of birth. However, if they're unable to do this because, for example, they don't speak English or they have dementia, then some other ways you can identify that person is to check the photo ID on the blister pack if that's available, or you can ask them if they have any other identity cards such as Centrelink or Veteran Affairs that might help you. If necessary, you could use an interpreter by phone to identify the person. If a person does not have any means of identifying themselves, then you must speak to your supervisor, a family member or carer before you proceed. Once you have established the right person, you must check the person's full name and date of birth against the documentation prior to the administration of any medication. Don't be afraid to ask questions. Call your supervisor if you feel unsure about anything. The right medication. To ensure that you have the right medication, you must check that the medication has been prescribed by a doctor and dispensed by a pharmacist. You will also need to check that the medication is available, correctly prepared, and in the correct dose administration aid, for example, a blister pack. Then you will need to ensure that the medications match up with the instructions on the person's medication support plan and the medication order if there is one available. The medication support plan guides you in what medications the person requires support with, and also gives you other information that will ensure you support the person in a safe and effective manner. It must be checked every time that you support with medications, just in case anything has changed. If the medication and the medication support plan do not match, or you're in any doubt that you are giving the right medication, call your supervisor. The next thing to do is to look at the medication itself. Check that it looks right. Is there any different about the size, shape, colour? If there is, call your supervisor before you give it. It could be something simple, but if it looks different, you may have the wrong medication. The next step is to check the expiry date. It is very important to ensure that medications have not expired, as this may result in a person having an adverse effect to the medication. If you make a mistake, follow your organisation's policy and procedure for reporting medication errors. The right dose. The right dose is how much medication you are supposed to give the person at one time. Firstly, check the medication dose that is listed on the medication support plan and the medication in the dose administration aid. Are they the same? If you are measuring a liquid dose, check that you have measured the dose accurately. If there is any doubt that you are not giving the right dose, then call your supervisor. If you find that there are any discrepancies in the dose or you make a mistake administering medication, then follow your organisation's policy and procedure for reporting medication errors. The right time. It is important that medications are given at the right time. Medications are normally administered at specific times of the day. This is because time intervals for medications are calculated to ensure that the person receives the correct dose over a 24-hour period. Also, medications may be given at a particular time, for example before meals or after meals, in the morning or at night, to ensure that they are effective and to minimize any side effects. Your medication support plan will give you instructions as to each time the medication must be given. You should also check the medication itself for any special instructions. If the time that is indicated on the medication does not match the time on the medication support plan, or you're in any doubt, then call your supervisor. The right route. The route means how or where the medication goes into the body. Many medications are taken via mouth, but others enter the body through the skin, rectum, vagina, eyes, ears, nose, lungs, or by injection. To ensure you are administering via the correct route, check the medication support plan and medication order if it's available. The route must be clearly defined. Also look at the medication itself, as there is often information given. For example, the medication may be for topical use or for external use only. If the instructions do not match or there is any doubt about whether you are giving the medication by the right route, call your supervisor. If you are giving several medications by different routes at the same scheduled time, be careful. You must deal with each medication individually, or you may inadvertently administer the medication via the wrong route. For example, if you are administering eardrops and eye drops together, follow your organizational procedure to administer the eye drops and then safely store them away before you start to administer the eardrops. If you make a mistake, follow your organization's policy and procedure for reporting medication errors. The right documentation. Any involvement with medication must be documented appropriately. Your organization will have specific documents that must be completed before medication can be administered. For example, a medication assessment form, a consent form, a medication order or medication support plan. There are also further documents that you will need to complete when you are administering medications, and they are a medication record sheet, the progress notes, and a medication incident form. The medication record sheet should be completed each time you administer medication. The document should have all the information you need with regard to administering the medication. For example, the person's name, date of birth, type of medication, time and date that you are giving it. There should also be a place for the person administering the medication to put their initials or signature. If you do not give the medication, then there should be a code with an entry you should use to indicate such occurrences, such as self-administered, refused, or given but not seen taken. The progress notes may be used to record medication-related information, but are not usually used to record actual administration. So, for example, you might record that you contacted your supervisor about the medication issue or that the medication incident occurred. The medication incident form should be completed each time there is an incident. This can be an adverse reaction to the medication or an incident around giving the medication. Reporting medication incidents is a positive action as it assists your organization in identifying problems, and it also promotes safety. There are a few simple rules to use when completing any documentation, and they are: report concisely and clearly. Record the times and dates. Avoid using jargon. Use acceptable abbreviations only. Write legibly. Cross out mistakes and initial them.
For more information about progress notes and report writing, watch the video on Community West's YouTube channel. And for more training, tools, resources and sector news, or to contact us, visit Community West's website or follow us on Twitter or like us on Facebook.